Thank you very much for introducing me. As she said, my name is Abebe. I'm from Ethiopia. Today I'm going to present core facility establishment for integration of pathogen genomics into routine surveillance and outbreak detection for sustainability of pandemic response and responses. This is really very important topic, I think, for the resource limiting country. Let me start with the role of pathogen. It has been presented by many presenters. Role of pathogen genomic surveillance and outbreak detection is, it is very important for routinely monitoring pathogen and also by analyzing their genetic similarities and the differences. This starts from sample collection, sequencing, data analysis. Then we can use this in combination with metadata and other epidemiologic data to use for timely public health action and decision. The data generated from genome sequencing also can be used as raw material for research and development, such as development for therapeutic vaccine and other diagnostic kits. And so it is really very powerful for surveillance. In addition, pathogen genomic is very important during outbreak detection, as we know, as we have got experience from the SARS-CoV. Should be timely, sample collection, sequencing, and the data analysis really very, very important during outbreak investigation. For that matter, genomic plays a crucial role as we get experience from SARS-CoV. So whole genome sequencing play a crucial role in that case. Also, if the pathogen can be not detected with a standardized method, we can also use a metagenomic for detection of pathogen during outbreak. In this case, the most important question is, this is a powerful tool for public health. How we can use this powerful tool for public health under sustainable manner, particularly in low limited setting, like in Ethiopia, how we can use genomics for public health. As it is indicated by Africa CDC and other partners, the number one is integrating pathogen genomic into the existing surveillance system and also outbreak detection, because we have many surveillance systems that not use genomics. If we use that system for integration of genomic into routine, really it is very important to use the existing surveillance sites, the existing sample referral system, the existing laboratory quality management system, particularly to generate reliable data during surveillance as well as during outbreak detection. And also we can use a well-standardized sample chain management system and the public health emergency management system during outbreak. If we use the existing system, it may sustain the use of genomics in public health. In addition, if we use regarding data, national data utilization and the sharing policy, if you use the existing system, it is really very easy. The second one is the most important thing, is establishing pathogen genomic core facility. As we know, we have various surveillance programs, that's disease programs. It is very difficult to establish pathogen genomic laboratory for each individual program. Therefore, it is really very important to establish a centralized genomic core facility that can support all disease programs we have at our institution. So this centralized shared pathogen core facility will serve or provide service for all pathogen genomic or programs that we can have, that also strengthens our capacity for preparedness of the coming or the next pandemic. So if that's the case, what is a core facility? Core facility is it is a unique program, neutral, and supports all institutional program. As I said, it is a centralized and it's cost-effective to get technical service, scientific expertise, and support for document preparation, and so on, we can use at one center. So if it is successfully we established, we can get such like the technical support for at one center. And if our institution is large, we can have 2 to 3 core facilities that can be for sample preparation, media preparation, nucleotide synthesis, or genomic sequencing. Even for PCR center, we can have at one center that can serve us. So if the core facility is really very important to sustain a pathogen genomic for public health, what you have to consider when we establish pathogen genomic core facility? Not only pathogen genomic core facility, any core facility, we have to consider these things. The staff in the laboratory space should be belongs to the core facility that will serve independently or give equal opportunity for all service we have. Because this is really very important, because if you don't have such like, if you don't consider such like things, it will create a conflict of interest among the different disease programs. So if the laboratory equipment, all property should be belongs to the core facility. The core facility should have its own directorate, the laboratory head of the core facility. And you have to develop a mechanism how you can sustain pathogen genomic core facility to give uninterrupted service for our stakeholders. Our stakeholders are the disease programs, and the operational management you have to have, how we can share data among our stakeholders, among our partners, should be considered before our going to establish the pathogen genomic core facility at our institution. So after saying this one, the PHI, Ethiopian Public Health Institute, started pathogen genomic core facility for the purpose of SARS-CoV pandemic response in 2021. Since SARS-CoV at the beginning it was not in any program, the Ethiopian Public Health Institution management decided to assign 11 individuals from different directorates. These 11 individuals from different directorates were participate in response to the pathogen genomic activity, particularly sequencing SARS-CoV-2 during the pandemic. In addition to their activity at their own laboratory, they also participate in pathogen genomic activities. Still, we don't have a full-time employee in pathogen genomic core facility at Ethiopian Public Health Institute. We are working in another department, and they come together, and partly we are working on the pathogen genomic core facility. But currently, our management decided to get a pathogen genomic core facility. This pathogen genomic core facility will have a pre-PCR workspace. It was designed the Illumina engineer, and we will have a post-PCR work space. We have been using the post-PCR workspace for SARS-CoV sequencing and for HIV, and the pre-PCR workspace have been used for HIV diagnostic, but currently they decide to use all this laboratory for pathogen genomic core facility. That means, as I said, we have to consider the space. The space should be free of any program, and now we got any space that will provide us for pathogen genomic core facility. And also we have a bioinformatics workspace in this case, and this sample follows in unidirection. After we sequence, we are going to use the bioinformatics workspace will network it with the post-PCR or the sequence machine. And if you have we have workforce. Partly, we have a laboratory space. Also, we have equipment, such like equipment. We have a Sanger, which have been used for HIV sequencing. We have Illumina. We have Nanopore. We got MySeq. We got from Africa CDC. Nanopore from UK Health Security Agency, as well as automated extraction machine and the SPT liquid handlers, Hamilton, from UK Health Security Agency, as well as from Africa CDC and the SLM. And also we are going to get NovaSeq from Global Fund, and the other MySeq machine also we are going to get, and the high processor computer from our partners UK Health Security Agency, they provide us. So if you have what you have done so far, we have from the scratch, we could sequence SARS-CoV-2, and we could detect different variants. And in addition, we developed a 5-year pathogen genomic surveillance strategic document. In this surveillance strategic document, we included around 8 objectives. Among that 8 objectives, one is strengthening the core facility in wet lab as well as the bioinformatics or the dry lab. So in that, we have around 8 objectives. In that 8 objectives, we included the strategic action. We developed also a strategic action implementation activities. In addition, how we can work with our stakeholders with different disease programs, we developed term of reference. That term of reference will guide us how we can work with the disease program as well as with our partners. So we have a plan to work with AMR and other bacterial pathogen surveillance. And because we have well-established AMR surveillance at Ethiopian Public Health Institute, currently they have around 20 sentinel sites. We are going to collaborate with them and include pathogen genomics into AMR surveillance. So we included in our strategic document. And also we have a plan to work with viral pathogen genomic surveillance programs. We have different viral pathogen genomic programs, and also we have a parasitic disease surveillance program. Also, as I said, for outbreak, for environmental surveillance, we are going to use for infection prevention and control. That is particularly in hostile acquired infection. And we have a plan to work with One Health approach, particularly zoonotic and other environment with human pathogens. Also, we will work with public health research that we are, the surveillance data, as we know, generate different data. That data, how we can use for public health research, we have included in our strategic document. We got some challenges when for this pathogen genomic core facility. I cannot put a solution for these challenges. Maybe you can share your experience. We cannot assign full employee for pathogen genomics because we don't have no lack of well-defined career paths for this pathogen genomic core facilities in Ethiopia because it is new. And management and administration, the core facility leadership, we have like less experience, and quality management of the laboratories, and also not fully centralized, and we are not integrated so much with our stakeholders, different disease program. So we are going to use our TOR to integrate with them. And I want to thank all our partners that they are a backbone for not only for pathogen, for the Ethiopian health system, and from WHO, CDC, Africa CDC, all partners, they are supporting us. And thank you for listening. This is what I have. Thank you.